Hi guys, me from the garage again. Wanted to do a quick video on all of the alternative medicine stuff that I do to manage my pain and dislocations. Because that's really where my focus is right now on whatever it is that I have. Like I've said before, I'm currently dosed with hypermobility spectrum disorder, and I'm on a waiting list for an appointment with a geneticist because my doctor's fairly certain I have hypermobile EDS. So we're waiting on the geneticist to tell us whether it is that or if we need to do some more testing. So I'm still waiting, but I'm 38 and I've been managing this on my own my whole life. Obviously my parents took care of me, but in my adult life, I've basically just managed it by myself. And in my teens even, I was kind of just on my own for dealing with it because the doctors didn't have any idea what to do. So when I was in my early 20s, I discovered massage because I dislocated my hip when I was in high school, and then when I had my son, it made it a lot worse. So I was constantly having hip pain, and my leg kind of turned out, so like the arch of my foot kind of faced forward a little bit when I walked. And I ended up meeting up with a friend of mine whose boyfriend or fiance or whatever it was at the time was a massage therapist, and he was watching me walk in, and he's like, "Hey, what's going on with your hip? Are you okay? And I'm a massage therapist. I think I can fix that." And so I started seeing him, and it helped a ton, like so much. It hurt like the dickens, don't get me wrong, but in the long run, it helped a ton. So then I was addicted to massage, and that's why I became a massage therapist, because I was so impressed that it helped so much that I wanted to be able to help other people. And I wanted a better understanding of anatomy so that I could help myself. So I really feel like becoming a massage therapist has helped me better understand my body and my condition. And with that being said, I'm pretty body aware because I understand the muscles, I understand where they attach to bone, I understand what actions they're supposed to do, I understand what actions could have caused something to pop out because I understand my own anatomy. I highly recommend that anybody who is a zebra and has any kind of muscular type of things or joint type of things take some kind of anatomy class, because it's really eye-opening for your own condition when you understand the underlying anatomy of it all. So that's why I became a massage therapist. And then after becoming a massage therapist, I got into more contact with other types of alternative care providers. So I just ended up meeting more people. That's what got me into chiropractic, which has been a godsend. But I have to be very, very particular with my chiropractors, because some chiropractors like to over-adjust, and that's no good. So the whole, I need to see you 3 times a week for the rest of your life, that doesn't work for me. I feel like if you need to see me that much, you're not really fixing anything. And the chiropractors that only do spinal adjustments are just no good to me, because I need my toes adjusted and the arches of my feet and my ankles and my elbows. So I need somebody who's got extremity certifications. So the chiropractor I see now, it has several extremity certifications, and he is a fabulous chiropractor. If you're in Idaho, he's at Revitalized Chiropractic, and he's amazing. Dr. Jensen. I love him. He's so knowledgeable, and I really, really respect what he knows and what he can do, and that he understands that I know my body. So I can go to him and go, I'm pretty sure that like rib 4 on the right is out. And he'll go right there and go, yep, rib 4 on the right. So he listens to me, and I appreciate that very much. And he also, like I said, knows extremities, so he can adjust all the weird things that I have happen. So I highly recommend taking the time to find yourself a really, really good chiropractor. I think he was like my 17th chiropractor when I moved to this town. I went to a lot of different chiropractors because I'm really, really picky about my chiropractors. They really need to know what they're doing. And then acupuncture, I met her through a client, and she's amazing. I love her too. Vitality Acupuncture in Meridian, Idaho. Heather Bergstrom is her name. She's amazing. And I pretty much go to her for things that a massage or a chiropractic visit can't fix. So I see her for when my stomach's not right, or I'm not sleeping well, or allergies. I go to see her for all kinds of stuff. She's amazing. And then if I feel like I really need stretched out, because it's hard for me to stretch myself, I go to get Thai massage, or sometimes it's called Thai yoga massage or Thai body work. But it's basically yoga done for you. So your job is to relax and be a noodle. And they put you through a series of very, very deep stretches. But just make sure that, they understand that you're hypermobile and can only stretch so far before it's dangerous. And it's usually a lot sooner than it stops stretching. So my lady is very understanding of that. And also ended up teaching me Thai massage. So I love her too. But she retired. So I have to find a new Thai therapist. And then I also, I cup myself a lot. I got certified in cupping several years ago for my massage practice, and I find it very beneficial for myself. So I have a hand pump cupping set at my house, and I use that pretty frequently. I also use a lot of kinesio tape to stabilize my joints. I don't wear it for the full amount of time, because like the tape that I use is supposed to be good from 5 to 7 days, so you can leave it on that long. But for me, I feel like after day 3, it starts to irritate my skin. So I usually like pull it off within a couple of days of me putting it on, and then just give it a day to rest and retape it. But there could be like on Monday, I have my wrist taped, and on Tuesday, I have my fingers taped, and on Wednesday, I have my knee taped. So it changes all over the place. I tape myself a lot. Highly recommend that you get some education in taping too, because it's super, super helpful. And I feel like, again, if you actually take a K-tape class, it gives you the anatomy knowledge underneath to tape yourself better. I feel like the YouTube videos that are out there, and even like the videos that are from the companies that sell the tape, they tell you what to do, which is helpful, but if you don't understand what's underneath and what it's actually doing to the body, I feel like you kind of short yourself, because I've done tape and I've watched those videos, and then last year I got certified in kinesio taping, and I feel like I'm so much better at it than I was before. After all the YouTube videos I watched, I feel like the class really made it a lot better and more effective for me. So I tape myself a lot. I also do gua sha a lot, which is a scraping technique. Sometimes it's called Graston, sometimes it's called just scraping. But there's tools for it that you can get on Amazon. And it's just a light scraping of the skin to increase blood circulation and basically feed a muscle that's squeezing out its own blood supply because it's so tight. And in getting blood into that area, it helps to relax that muscle. So I love gua sha. I do it to myself all the time. I've taught my husband how to do it so he can scrape my back. But it's a really, really easy technique. That one I would say that you could go watch a YouTube video on and learn how to do it. But you don't want to, it's not like a dig thing. It's just a scraping of the skin just hard enough to move the skin around. But I do that a lot for when I get muscle tension and when I get tendinitis. That when my tendons start to really act up, I'll scrape them with a gua sha tool. Outside of that, that's pretty much all the alternative care I do regularly. I have done cranial sacral for headaches, and that was amazing. I loved that. And I don't do that often, but I do it when I feel like there's pressure in my head, or like when I get the tension headaches in the back of my skull, when I get cranial sacral, which is getting the muscles of the skull to relax to get pressure off of the skull. I found that to be very, very beneficial. So I still go see her every time I get headaches again, or I also get this like weird cold ear thing, and I'll go see her for that too, because she seems to really take care of it. And I've tried several different massage techniques, but it's just, I've got a person now that I go see that's a friend of mine, and he understands the hypermobility and my body. So again, you have to be particular. You have to find somebody who understands what being hypermobile means and what kind of things they need to do to prevent hurting you. So you have to be picky with your alternative care providers, but you have to be picky with your doctors too. So I think it's really important. And to take the time, sorry, I got distracted by my puppy back there in the corner. You have to take the time to find the right people. So, and my people, like my doctor, he's very aware of all the alternative medicine that I do, and he's perfectly okay with it as long as I run it past him so that he can put his 2 cents in. You know, I don't think that that's a good idea for you. I think that might cause inflammation. You know, that's kind of some of the stuff that he said to me for things that I've wanted to try. So I run it past him and see what he says, and most of the time he's pretty cool with it. So find a good doctor, find a good primary care physician that understands what you want to do if that's something you want to pursue. But for me, it's just because I'm an alternative care provider. I'm a massage therapist, so I understand those circles and those types of treatments. So that was just the avenue that I've always gone down for my own care. I don't like taking pills if I can avoid it. There are times where I have to call my doctor and say, hey, I'm hurting in a bad way and I got to have something. So, but that's like maybe once or twice a year that it gets bad enough that some form of alternative medicine won't take care of it. So I've got a pretty good team. I don't know about my geneticist yet. I'm still waiting to meet with her, but I'm hoping that she's good. She came recommended by my doctor, so I'm assuming he knows what he's talking about. But those are the alternative care things that I do for myself. If you have any questions about any of those or any other things alternative medicine-y, I'm happy to answer questions. So just leave me a comment and I will get back to you as soon as I can. But it's worked for me. So I know that it does work. It may not work for everybody, but it does work for a lot of things. And I'm happy to answer any questions about it. So that's today's video, and I'll talk to you guys next time. Bye.